Entrapment neuropathy by Karley Schlensker. Entrapment neuropathy can occur in any joint in the body, but for this presentation we're going to be focusing on the elbow. The different structures involved in entrapment neuropathy in the elbow are the ulnar nerve, radial nerve, posterior interosseous nerve, median nerve, and anterior interosseous nerve. So this condition occurs when there's a structural abnormality that causes the nerves to be compressed, displaced, or put under traction. For the mechanism of injury, the pronator teres muscle can compress the median nerve. There can be injury to the superficial branch of the radial nerve, injury to the posterior interosseous nerve, an acute contusion or chronic compression of the ulnar nerve, superficial positioning of a nerve with a long course through an area of high risk for trauma, and a nerve with a narrow path through a bony canal. Signs and symptoms for entrapment neuropathy of the elbow include intermittent numbness and tingling in the fingers, a weak grip in the affected hand, difficulty controlling fingers for precise tasks, sensitivity to cold temperatures, and pain or tenderness in the elbow joint. Special tests. To know a sign is used to identify entrapment neuropathy in the elbow. The therapist should locate the ulnar nerve that is seated in the groove between the olecranon process and the medial epicondyle. The ulnar nerve is then tapped on repeatedly by the index finger of the therapist. A positive sign is indicated by a tingling sensation in the ulnar distribution of the forearm and hand, distal to the tapping point. Also, if the physician thinks it's necessary, they might have you undergo a nerve conduction test. The predisposing factors for nerve entrapment of the elbow are prior fracture or dislocations of the elbow, bone spurs or arthritis in the elbow, swelling of the elbow joint, cysts near the elbow joint, or repetitive or prolonged activities that require the elbow to be flexed or extended. Management and treatment. Avoiding movements that are repetitive or cause pain, using braces or splints, physical therapy, medication, and in rare cases, if they can't manage their symptoms, surgery. As an athletic trainer, if you cannot help your athlete with these symptoms, you can refer them to a physician to get further help. In order to prevent nerve entrapment of the elbow, limit repetitive activities that can make it worse. Do not lean on your elbow while driving or sitting. Keep your arms straight while at rest. Wear a splint while you sleep to prevent the elbow from bending, and try to prevent falls or direct impact to the elbow. There are no Mulligan techniques for entrapment neuropathy of the elbow. My PCOD analysis involved 15 men and 15 women with a mean age of 30 years old. The intervention was they measured the diameter of the posterior interosseous nerve of the elbow. The comparison was the diameter of the posterior interosseous nerve at 3 different locations. The outcome was that the difference in diameter size of the posterior interosseous nerve alone should not be interpreted as nerve entrapment. There is no time given. Here are my references and thanks for watching.